Hi, my name is Rakeem, and today we'll be talking about sepsis awareness for this month's Health Talk. So here are the contents we're going to talk about for today's talk. Firstly is statistics and trivia regarding sepsis, the definition of some terminologies, the stages of sepsis, what are the causes of sepsis, risk factors associated with sepsis, signs and symptoms, treatment, and lastly, some preventative actions we can take to avoid getting sepsis. So in Malaysia, the burden of sepsis remains high, being the top reason for intensive care unit admission nationwide, with an associated in-hospital mortality rate in excess of 50%. Means that in Malaysia, the rate for sepsis and death by sepsis for patients in ICU is more than 50%, which is quite staggering. Despite the magnitude of such problems, there is a dearth of available local data on sepsis. Means that there is limited statistics regarding sepsis in Malaysia. Let's look at some trivia globally. Sepsis is considered the number one cause of death in hospitals around the world. And globally, there are at least 47 to 50 million sepsis cases every year, with at least 11 million deaths per year. And among them, 40% are children under 5 years old. That's a lot. Let's look at some terminology and definitions. So, sepsis is where your body overactive and extreme response to an infection. So sepsis is a life-threatening medical emergency, and without quick treatment, it can lead to tissue damage, organ failure, and even death. So sepsis is just your body overreacting to an infection. Okay, usually it's bacterial infection, but it could be viral and fungi infection. And this can lead to a cascade of events that can become life-threatening. Septicemia is an infection that occurs when bacteria enters the bloodstream and spread, which can lead to sepsis. So, septicemia is a precursor of sepsis. Septic shock. Septic shock is a serious medical condition that can occur when an infection in your body causes extremely low blood pressure and organ failure due to sepsis. So this is the severe sepsis stage, where they will exhibit low blood pressure as well as organ failure. And then we have something called SIRS, or Systemic Inflammatory Response Syndrome, which is an exaggerated defense response from your body to a harmful stressor. It causes severe inflammation throughout your body. This can lead to reversible or irreversible organ failure and even death. Okay. Let's look at the stages of sepsis. So they are divided into 3 stages. The stages are sepsis, severe sepsis, and septic shock. So stage 1 is systemic inflammatory response syndrome. So sepsis can be hard to identify, but is typically denoted by a very high or low body temperature, high heart rate, high respiratory rate, high or low white blood cell count, and a known or suspected infection. The aforementioned signs are actually used to identify systemic inflammatory response syndrome, which only becomes sepsis when an infection is present. So if there's no infection, then we term it as systemic inflammatory response syndrome. Whereas if there is an infection, then it's considered a sepsis or sepsis. In stage 2, sepsis has progressed into severe sepsis. So the second stage is called severe sepsis and is diagnosed when acute organ dysfunction begins. So there is some issues with the organ's function, maybe breathing from the lung or maybe liver function. So any function of the major organs starts to have some sort of dysfunction, then that has entered into severe sepsis stage or stage 2. Severe sepsis can also be diagnosed when sepsis is present along with hypotension, which is low blood pressure, or hypoperfusion, meaning decreased blood flow through an organ. An organ dysfunction is categorized by symptoms such as decreased urine output, suddenly changes in mental state, decreased blood platelet count, difficulty breathing, abnormal heart pumping function, and abdominal pain. So here you can see some of the characteristics in stage 2 is the urine output is less, and then the patient may exhibit some sort of mental state changes, okay, maybe delirium or maybe confusion, and then as an obvious decrease in blood platelet counts, and of course difficulty in breathing, gasping for air. Partly because of this, urine output is one of the factors measured in the SSC sepsis 6 bundle immediately after diagnosis of sepsis to track the progression. And the last stage is stage 3, which is septic shock. Septic shock is the most severe stage of sepsis. It is defined as the presence of hypotension, low blood pressure, induced by sepsis despite fluid resuscitation. So despite the doctors and nurses infusing fluid water into the veins, there is still low blood pressure. Okay. In addition, perfusion abnormalities such as elevated lactate levels. Septic shock has the highest chance of mortality, which estimates ranging from 30 to 50%. So once that's reached to stage 3 septic shock, the mortality rate or the incident rate for death can go as high as 50%. So here is an image demonstrating the stages. So first is the source of infection, maybe in the lungs, and that bacteria travels into the blood, okay, enter the blood through one of those blood vessels or arteries that go through the lung, and this causes leaking of blood vessels, and it could progress into further stages like organ dysfunction, like here is the heart, kidney, and liver, and lung. And once it affects the brain, that's where the altered mental state happens, and ultimately, if nothing is done, it could lead to death. Okay. So here are some causes of sepsis. So any type of infection can lead to sepsis. This includes bacteria, which is mostly bacteria. But virus and fungal infections could also lead to sepsis. So those that more commonly cause sepsis include infections of lungs, such as pneumonia, kidney, bladder, and other parts of urinary system, digestive system, bloodstream, catheter sites, and wounds or burns. Let's talk about risk factors who are more susceptible to sepsis. So some factors that increase the risk of infection will lead to sepsis include people who are over the age of 65 due to their compromised immune system, infancy, okay, developing immune system in newborns, people with lower immune response such as those being treated for cancer, people with human immunodeficiency virus, which is HIV, People with chronic diseases such as diabetes, kidney disease, or chronic obstructive pulmonary disease, or COPD. Other than that, admission to intensive care unit (ICU) or longer hospital stays can increase the risk of getting sepsis. Devices that go in the body, such as catheters in the vein, called intravenous or breathing tubes. Treatment with antibiotics in the last 90 days, or a condition that requires treatment with corticosteroids, which can lower the immune response. So what are the signs and symptoms that you should look out for early signs of sepsis? So symptoms of sepsis are not specific. Okay, that's one thing. They can vary from person to person, and sepsis may appear differently in children than adults. But some of the common signs and symptoms include a change in the mental status, fast, shallow breathing, sweating for no clear reason, feeling lightheaded, shivering, symptoms specific to the type of infection such as painful urination from a urinary tract infection, or worsening cough from pneumonia. When it comes to septic shock, here are some of the common symptoms. For example, not being able to stand up, due to weakness, strong sleepiness or hard time staying awake, always feeling sluggish, feeling sleepy and fatigued. Major change in mental status such as extreme confusion. Let's talk about treatment. So sepsis treatment needs to begin immediately as it is an emergency, a medical emergency. The most important concern in sepsis protocol is a quick diagnosis and a prompt treatment. If your provider diagnoses you with sepsis, they'll usually place you in the intensive care unit of the hospital for special treatment. You may receive the following treatment for sepsis. So if you have bacterial infection, you will most likely be given antibiotics. Whereas if you have virus and fungal infection, antibiotics will not be effective. IV fluids. IV fluids, you will need fluids to maintain blood flow to your organs and prevent blood pressure from dropping too low. So they will infuse water into your veins. Vasopressure medications. So vasopressors tighten your blood vessels. In some cases, you may need them to reach an adequate blood pressure. So if they detect your blood pressure is low, they may give you vasopressors to help to improve your blood pressure. Appropriate supportive care. If organ failures occur, you'll need other sepsis treatments such as dialysis of kidney failure or mechanical ventilation for respiratory failure. So if it affects your kidney, then you may have to go for dialysis. If it affects your lungs can't function, then you may have to be intubated for mechanical ventilation. And then surgery, you may need surgery to remove the damaged tissues. So how do you prevent or reduce the risk of getting sepsis? So here are some practices that you can do, especially if you're in a hospital, ICU, where there's a lot of sick people. First is practicing good hygiene, which includes washing your hands regularly before and after meals, and also before and after contact of patients and sick people. 2. Keeping cuts and other wounds clean and keeping them covered until healed. So covered with dressing or bandage. Let them clean lah. Keep them clean. 3. Keeping up to date on recommended vaccines. So check that your vaccines are still effective. If not, you may have to go for a vaccine shots. Number 4, getting routine medical care for chronic conditions. And number 5, getting medical attention immediately if you suspect an infection, based on those symptoms we mentioned previously. That's all. Thank you. If you have any questions, please leave them in the comment section below.